Hello everyone. I have the pleasure today. I am honored to have in our office to talk to us for a little bit the medical director of the ER at StoneSprings Hospital, Dr. Nasif Ahmed. Dr. Ahmed, thank you for being here. We appreciate you. I know we have only short time with you, but I know it is very important subject for everybody, not only young or children, it's adult, is everybody. Can you tell us a little bit about yourself and what led you to be part of this wonderful hospital, StoneSprings Hospital?
Sure. Well, thank you for having me. I'm honored as well that you asked me to come on. So just a little bit about myself. I actually grew up in the area, so nearby Fairfax County is where I went to school. I then went to Chicago for college and medical school. I then went to Philadelphia and trained in emergency medicine there before returning home to the area. So I also work at Reston, our sister hospital to StoneSprings, and I was given the opportunity to become the assistant medical director at StoneSprings, and now I've been the medical director for the past 3 years. So a true honor for you to have me on, and again, we're really just proud of the work we do there.
So Dr. Ahmed, probably you heard about a lot of this question. I am probably one of them, and probably a lot of people, they will get confused when we should go to the ER. And can you share with us, please, some info about that?
Sure.
And when do you think it is really necessary to go to the ER? Because we know sometimes, things happen suddenly. Do we need to go to the ER or not? Let's go to the ER or not. And people get confused when we should go.
Sure. First and foremost, no matter what the complaint is, no matter what's going on, if you come to our emergency department, we're going to see you, we're going to evaluate you, we're going to try to help you out. So that's first and foremost. This question does come up a lot, especially during the pandemic. People didn't know, should I go to the ER? Should I go to urgent care? Should I make an appointment with my primary care doctor? There are some instances where if something, is maybe small or minor, aches and pains, something that's a minor cut, those things can go to the urgent care. Whereas if you're having trouble talking, walking, you're bleeding and it's not stopping, any of those things, absolutely come to the emergency room. And in many of those cases, call 911. One of our goals is to promote education on recognizing symptoms of stroke, for example. So if your face is drooping or you can't move your arm or your leg, it's very important that you call 911 and come to the ER immediately. Same goes with anything related to the heart. If you're having crushing chest pain, you're sweating and you can't breathe, again, call 911, come to the ER. So if it's something in between and you're not sure, you can still come to the ER. We're still going to have someone evaluate you and try to help you out. But those are sort of the major things that we look for.
The major thing. What about like kind of dizziness? Like sometimes, you got dizzy suddenly and you can't stand up, or you fall down, you pass out, or anything like that. What causes kind of like these things?
I'm glad you brought that up. Dizziness is a tricky one, but dizziness can be a sign of a stroke. And so certainly if you're feeling like the room is spinning and you're throwing up or you can't focus, or as you mentioned, if you're losing consciousness, then again, 2 more reasons to come and get evaluated. Now, if someone's passing out, it can be from many different reasons. It could be you're dehydrated or maybe just stood up too fast. But in some other instances, it could be a problem with your heart or the blood flow to your brain. And so definitely important to come and get evaluated.
Okay. And what are the most signs or conditions you are seeing lately in patients after the pandemic? We know it was a lot of stress time, this pandemic, and now, we hope we won't have any pandemic anymore. But lately, like for the last year, what is most symptoms you're seeing, people coming to the ER? Conditions.
We see everything, and it can vary from day by day, month to month. Certainly in the fall and winter, we're seeing a lot of upper respiratory illnesses. Lately, we're seeing some stomach viruses. But again, as you mentioned, post-pandemic, very, very stressful time for everybody. mental health is very important. And so sometimes, that anxiety and stress can translate to some physical symptoms, and you're not sure whether it is mental health related or something else. So that's our job, to help you figure that out. So we are seeing a little bit of everything, but definitely a lot of that.
Do you think what is the most dangerous thing can happen? Is mostly like the pain, or you think, what about like blood pressure? People talk about blood pressure, suddenly it will go up.
Sure. I can't put my finger on the most dangerous thing. There are too many. But blood pressure is very, very important. A lot of people walk around with high blood pressure and they don't realize it. And so that's where it's important to get your annual checkups, see your primary care doctor, get your physical, and make sure that those important things are being tracked. I think a lot of people are sometimes scared or they don't want to know. But I think it's always important to just get that information so you know what you're dealing with, and in many cases get on the right medications for those conditions.
Yeah. And I want to tell you, Dr. Ahmed, this is from my personal experience. I have been at the StoneSprings Hospital twice at the ER, and I want to let you know, thank you to you and your staff, because I have been treating very well, and I went in really, really pain, and in 15 minutes I saw all the doctors around me, and the pain was gone, and great. And by the way, the cleanliness of the hospital is amazing, which is, I know it is the first part, and the staff, everybody was smiling and encouraged me that to don't worry, everything gonna be fine. And the support I felt as person going to the ER, because people go to the ER and they're scared. They're scared. Okay, what's gonna happen? Well, where I am I okay? Am I not? So I will give a huge shout out to you and to your staff too. And thank you for being here and sharing with us. And we will put also the website if anyone need more information. So as Dr. Ahmed said, do your physical every year. That's the most important, where you need to know all the result and everything.
Absolutely.
Thank you very much. Thank you, Dr. Ahmed.
You're welcome.